Hi, today I want to discuss about the unfortunate children who have neurogenic bladder and bowel. Neurogenic bladder and bowel is very common and very typically it is secondary to congenital spinal cord problems called as spina bifida, meningomyelocele, or what we call as spina bifida occulta, tethered cord. So all these are congenital problems of the spinal cord where the spinal cord is abnormally formed and it is attached to various structures which don't let it function properly. The nerves are damaged, and the commonest nerves to be damaged are the nerves that control the function of the bladder and bowel. So we have a spina bifida foundation, and we see a lot of these children with neurogenic bladder and bowel, which means the bladder and bowel function is disturbed because of neurological damage to the nerves of the spinal cord. So the first step, of course, is to repair the spinal cord. We have a team of pediatric surgeons and neurosurgeons. We, as a team, we repair the spinal cord defect in the child, which is the first step. But so after the spinal cord defect is repaired, some of these children, they have an improvement in the bladder and bowel function, but in majority of these children, the damage to the nerves has already occurred before birth or shortly after birth. So the problem of control of urine and stool is likely to continue even after the spinal cord surgery. Now, there are two aspects to this problem. The first aspect is with a bladder and bowel that the child has no control, the child will have social problems. Like, these children may present with continuous dripping of urine into the pants or the undergarments. They may have to be continuously in diapers. They may also have repeated urinary tract infections, and they will not be able to pass urine normally with sensation like normal children. With the bowel also, similar problems can occur. Majority of them have constipation with leakage of stool into the pants time to time. So because of this, these children have major social issues. So they will be socially outcast because they will have to be on diapers all the time, or they will be smelling of urine and stool, and they will not be able to take part in the normal activities that a normal child would like to take part. This is one aspect. The second aspect is that the neurogenic bladder, or the bladder which is misbehaving because of loss of neural connections, this bladder can create very high pressures which can cause repeated infections to the kidneys and can be potentially a source of damage to the kidneys. Unfortunately, we see quite a few children who have neglected neurogenic bladder, which has already damaged the kidneys significantly. So the treatment of these neurogenic bladder and bowel, let's talk about the bowel later. The treatment of the neurogenic bladder has two important components. One is to make the child socially continent so that the child will be able to hold urine and empty the bladder. May not be by natural means, maybe by artificial means, but the child should be able to hold urine without dripping continuously, should be off diapers, and should be able to empty his or her bladder by some artificial means from time to time. And the bladder also should be of a low pressure and a good capacity so that the kidneys are safe. So these are the two main aspects: to make the child socially continent and to keep the kidneys also safe. The treatment of this is complicated because every neurogenic bladder is different. No two neurogenic bladders behave the same way. So the treating doctor needs to, usually treatment is done by a pediatric urologist. So we have a specialized spina bifida center at our place where we take care of all these children. They require specialized tests called urodynamics and video urodynamic studies, and with other radiological investigations and the urodynamic studies and a proper history and a bladder diary, we should be able to identify which type of bladder we are dealing with, and the treatment is specifically tailored to the type of the bladder, to the type of the damaged bladder that we are dealing with. And you can say that with proper treatment, with proper identification, analysis, investigations and treatment, majority of these children can be made socially continent and they lead very productive and near normal lives. So that is the first thing. Second thing is, of course, the neurogenic bowel or the bowel dysfunction. So the treatment of neurogenic bowel is easier than the treatment of the bladder. There are simple techniques to make the child socially continent for stool, and to prevent stool from leaking into the pants without the child's knowledge from time to time. So unfortunately, I still see quite a few children who have been neglected with the neurogenic bladder and bowel, and they have had significant damage to the kidneys. And the children at 10 years and 14 years, I just saw a child today who's 14-year-old who's still in diapers. So all this can be avoided and should be avoided. And these unfortunate children and the parents, they should know that there is effective treatment available for majority of these children to achieve social continence, and these children can lead a near normal life. Their quality of life improves so much. Some of the children we have treated have become engineers, and they actually have migrated to out of the country, and they're actually working there and they're leading a near normal life. So this is very important for the parents to realize. And on this National Pediatric Surgery Day, which is 29th of December, let's pledge that we will spread this information and we will not let any child with the bladder and bowel dysfunction, either neurogenic or non-neurogenic bladder and bowel dysfunction, we will not let any child suffer, and we will hope that all these children receive proper and timely medical care. Thank you.